My name is Beth.
My name is Darshan.
We are exercise physiologists and we work at Walford Jewish Hospital. As an exercise physiologist, what we do is we use exercise as a form of medicine or treatment to help individuals manage their long-term health or any complication or query that may have. And we use exercise as treatment. We look at lifestyle interventions and trying to encourage people to use exercise and movement to look after their health in the long term. Exercise physiology being quite different and similar to physiotherapy. There's a little bit of crossover, but there are points of distinguishing factors. A physiotherapist, you would attend one in your initial stages of treatment. Their role is to diagnose and to manage injury or incidents in that first period, so maybe your first 4 to 6 weeks of a diagnosis or an issue, to get you moving more confidently, engaging muscles, working through some pain barriers, and getting you up and moving again for that initial time period. You might then progress to an exercise physiologist where we look at the longer term intervention, or we look at the bigger picture and how we're going to get you moving safely, comfortably for a long period of time, and also maybe prevent you attending a physio in the first place. So think more of a time frame as to when you would see a physio being more of your acute or short-term treatment, and then moving on to exercise physiology for your longer term planning, looking at the whole body as a whole.
So just a little bit of, I guess, some tips and pointers from us. One of the things I think that's very important for exercise specifically is that understanding it's a very unique therapy. It's a very active therapy, so it's not something that anyone can do for you or make you sort of do in that sense. And the best way to get the most out of exercise is to actually stay consistent in the long run, which means sort of enjoying what you are doing, finding enough of a challenge to keep you interested, but actually wanting to persevere with what you are doing. Next thing is to understand that motivation is great initially, but consistency and adherence in that regard is very important. And consistency doesn't necessarily mean doing the exact same thing all of the time or progressing all of the time. Especially with arthritis, you might be looking at more of times where there's flare-ups and times that are good. By all means, when you're having a good period, challenge yourself and push through. But when you are having a flare-up, managing your symptoms is very important, and then using movement and exercise as an adjunct is key. And the way I would sort of make it a little bit simpler is, if you're looking at exercise to improve in the long term, like you just do a lot of different variety of things. During a flare-up, similar to brushing your teeth, you do it twice a day, you're not necessarily happy to do it. It's something that you just know that you've got to get done. Exercise can be like that during a flare-up. It's something that you manage to do over that period. And the final thing, I guess, is pacing yourself. It is a journey. It's not something that is going to be finite in that regard. So making sure that you sort of check in with yourself and understand as you progress, things can change. So it might be a good opportunity to just check in base with the exercise physiologist to see how your new goals, or if your goals have changed, how that might, how exercise can change to fit that better.
I'll just leave you with one more tip or thing to think about is the idea of pain and discomfort. When you're doing exercise, you will experience a little bit of discomfort, and it is okay to have some pain. We don't want to be at a point where you are got these sharp shooting pains going up and down the body. That's not okay, but a little bit of uncomfortable feelings is totally normal. It just means that you are actually activating the correct muscles. If you feel it around the knee because you're doing a sitting and standing exercise, well then that's normal. So some discomfort is okay and it's actually a good thing, but sharp shooting sudden pains is not okay. On the other hand as well, if you hear a crack or a pop, generally that's also okay. Unless that is causing significant pain, then that's an issue. But those things are normal. How you access an EP and where you might find us. We work across multiple sites. You can find exercise physiologists at private hospitals, at private practices. You can also get exercise physiologists coming to your home. There is a website called Exercise is Medicine, or even ESSA. ESSA is the governing body association of the exercise physiologists in Australia. And there's a feature on that website where it says find an EP, and then you will be able to access based on location or search from that function. It's also good to talk to your GP about seeing an exercise physiologist. They will have a good network and good pool of resources for you, which you can discuss with them. And they may also suggest that you may organise the Medicare funded program where you get access to an exercise physiologist or allied health professional at a subsidised rate from the government. So that's getting a care plan, and that is going through your GP.